our panel today will discuss how research culture evolved throughout the Syrian conflict. And we are lucky to have prominent speakers and panelists with us today. So please allow me to welcome our 5 panelists. Briefly, I will introduce them. Dr. Housam Nahhas, who started his medical school in Aleppo, but then continued this in Istanbul after he fled to Turkey. And Dr. Housam was involved in many initiatives and humanitarian interventions in the cross-border response in northwest of Syria, and worked with many organizations, including UOSSM, and he's a graduate from the Johns Hopkins Program School of Public Health. We have Dr. Maher Al-Aref, who's currently the head of mission of UOSSM France for northwest of Syria. He has a degree in pharmaceutical graduate from Aleppo, and also he has a master's degree in health economics from Liverpool School in 2011. And he's part of many coordination mechanisms and platforms in the health and humanitarian response in northwest Syria. So personally, when I have issues to ask about the humanitarian response in northwest Syria, I turn to Dr. Maher. We have Kristen Meaga. So my colleague at King's College London, she started, I think, 4 years ago with King's, and she has a hybrid role as a program manager who really runs our projects in the conflict and health research group at King's. For example, the research for health and conflict in the Middle East project, and also the research for health system strengthening in Northern Syria project. And also she is a PhD student at King's. She leads an initiative, a very distinctive initiative in King's called the Women Leaders in Health and Conflict, which has been running for a few years by now. And also previously she worked with on refugees and other humanitarian settings. Dr. Hani Taleb, he is the Chief Executive Officer of Relief Expert Association, and he took part in designing and implementing many health interventions in public health research in northwest of Syria since the start of the response in 2011. And he's currently in London pursuing a degree in health policy planning and financing at London School of Economics and London School of Hygiene and Tropical Medicine. And last but not least, Diana Reyes, whom we introduced in the first session. So Diana is a non-residence fellow at the Tahrir Institute for Middle East Studies for policy, focusing on regional public health policies. And she's a PhD candidate in international health at the Johns Hopkins Bloomberg School of Public Health. She's a steering committee member of the Syria Public Health Network. So thank you, our panelists, for joining us today. So I will turn to you now a very general question that I would like each one of you to comment in 5 minutes on this question. So how do you think research culture evolves throughout the Syrian conflict? So what are the factors that either encouraged or discouraged research culture to evolve? And if you can base this, your comment or answer on your own experience and how you observed this evolvement in your own relevant institutions. So maybe I will start with, as my screen shows, if you allow me to start with Dr. Hani first, Dr. Hani Taleb, and then Housam, Maher, Kristen, please. Okay, to allow you to.
Okay. I managed to do it. Thank you very much. Well, thanks a lot, Dr. Abdulkarim, and thank you for a wonderful day. It's been really fascinating to see all of the brilliant minds working together, producing these brilliant researches. I want to actually pick on your second question, which about factors that may encourage or discourage research culture, and particularly in Syria. As you know, one of the main drivers for health research is problem solving. This is one of the main drivers, in my opinion, and we've seen excellent examples of this driving factor today and over the past year, especially with COVID. However, this is not always the case, not in Syria and not in many places in the world. where, in my opinion, a potentially simple explanation lies with the actors in the health research stream. So, as you know, three of the main actors in this stream are donors who fund research, then international institutions who usually lead such research, and then those who actually either feed into or utilize this research, and name it, if you will, the utilizer group. So when you look at this equation, you see that it's international donors funding international research actors to potentially do local research. Now you see the equation here. It's international trying to resolve issues that are locally raised. And the problem here is, in my opinion, is that you don't always have an agenda that is actually aligned between these three actors. So you may end up with brilliant research that never get used, or you may have brilliant questions, many important questions that never get funded or even never get looked at. And this is, in my opinion, is a major issue to why we don't have enough researchers, or why we don't have the quality sometimes of the research that we want, or why we're not always looking in the right place. What's really great to see is more and more Syrians stepping up into this, getting involved with the research, with the academia and the research stream, and having more and more Syrians advocating for donors to look into the right place. I think this is the promising part of this equation, in my opinion. And when it comes to some examples from my own experience, I'd say that, well, the organization that I work for, Relief Experts Association, UDER, is pretty young organization. And over the past 4 years, we tried to tackle issues around the Syrian community's health behavior. One recent example is related to communities' adherence to preventive measures and the discrepancy between what people report or claim in terms of their behaviors and what they actually practice. And we actually realized that as an NGO, although we've been collecting a lot of data over the past 4 years, and you all know about this, Dr. Abdulkarim, although we've been doing this, we also realized that we don't always have what it takes to interpret this data and put it into use. We may be collecting data in the wrong way, or maybe looking the wrong type of data altogether. So what we did is that we did reach out to researchers from the academia to help us interpret this data and the data that we collected. And what I genuinely believe is that a successful marriage, so I want to say marriage, not cooperation, because it has to be meaningful cooperation, meaningfully putting hands together between the implementers, those on the ground, those are tackling or providing services, or even the community itself, and the academia. This kind of cooperation, in my opinion, is inevitable. Thank you. Over to you.
Thank you very much, Dr. Hani. That's why it's good to have voices like you in such conferences, because we need always to be reminded about the importance of this, not only collaboration, but I really like this marriage. And we're trying to do this a little bit in the Research for Health System Strengthening project, the way we engaged with the health directorates on the ground, and also with UOSSM, our colleagues in Turkey. And we're trying to expand the network. But I think as a general culture and mentality of academic institutions, I think this is very much needed. So thank you very much for this comment, and I'm sure we will have opportunity to discuss this further. So I will turn now to Housam Nahhas. So Housam, if you can comment on the same question related to research culture, please.
Thank you very much, Dr. Abdulkarim, and thank you very much for inviting me to be a panelist in this an interesting panel. And well said, Dr. Hani. Thank you very much for setting the stage for this. I would like, actually, the question you asked, Dr. Karim, is a question I always have in my mind as point of grounding and as a reflection, recalling my time when I was working inside Syria in 2012, when the uprising started, opening the opportunity to do in-depth analysis of the conflict research, war analysis. And I believe that from my personal observation, research culture went through 4 major steps that led us to what we are witnessing today with more involvement from Syrian researchers. So the first stage is when we were working inside Syria under really like demanding environment, huge security concerns. And I recall, if Dr. Mohammed Hariri is here, when we were like even delivering these basic health services to injured individuals during protesters, we tried to do this basic research or like case studies to better understand the situation and how we can improve quality of services, but that was not feasible because there were concerns around the privacy of our patients and also our security, which discouraged this kind of practices in the early phase. And then when we moved to working in field hospitals in non-governmental controlled areas, also from a personal experience, we tried to develop some really high niche researches that are not like that were important to better understand the situation and improve healthcare. But unfortunately, because of the very high load, like workload in these hospitals, it was almost impossible to implement researches, and it was like, again, demanding environment, limited resources, stressful time on everyone, being under constant threat of being targeted or even killed as a healthcare professional really was disabling healthcare professionals or researchers in from conducting any meaningful research as locals. I think then when things start to get more chronic, this is when it became clear that we had a lot of problems, as Dr. Hani mentioned, that needed to be solved and needed to be solved by locals, not international researchers who may not have any idea about the context and the situation inside Syria. So this brought us to the third step when we were able to bring up some really important and meaningful research questions, but needed the support in conducting these researches. Needed like experts from outside Syria to help conducting these researches and interpreting the data, as Dr. Hani mentioned, which really started showing us how important it is to produce evidences and doing this in-depth analysis for the war and understand how health services can be improved in such environment. And then we went through the fourth step, like the fourth evolvement in the research culture, when we started as Syrians to get opportunity to know more about the public health research culture, which was not part of our education when we were studying in Syria, studying medicine, and like we got the opportunity to be chief nurse, go like study more about research. I got the opportunity to do my MPH at Hopkins to better understand, and now we got the opportunity to be leaders in the research, supported by like collaborating now more, or like having this marriage relationship with other international entities and international academic institutions, again to what like to implement what Dr. Ola mentioned earlier in her speech, it like an impact-driven researchers rather than only descriptive research. So I think right now we are in this step, working like actively producing knowledge, doing analysis, having this sense of ownership on the research we are conducting. And as we are going for this step, we need to continue support our colleagues who are still inside Syria and give them this sense of ownership, and like really make sure that their voices are heard outside. We had the privilege, in my belief, we had the privilege to be outside, to really like improve ourselves, get higher education, and it's our responsibility to transfer this knowledge to future researchers, Syrian researchers inside Syria. So I would like to conclude with this and move it over to you.
Thank you very much, Dr. Housam. this focus on the cohort of the Syrian researchers or Syrians who were able to maybe gain more academic experience and how they make sure that first they do meaningful research related to Syria and then transfer this knowledge back to their colleagues in the field. So I will move now to Kristen Meager, and especially for Kristen, because she's been leading this initiative of women leaders in conflict and health, and also her research concerns gender-sensitive approach in health research. So I'd like you maybe to comment on the same question, but also if you can comment on the importance of gender-sensitive approach in health research in the same context.
Great, thank you, Karim, and thank you to Hani and Housam as well for some really great points, which I'd just like to reiterate as well. I think I've been very fortunate to be involved in the R4HSSS project and see that we are really working towards a community-led and a Syrian-driven approach to the research and the evolving research agendas within the context as well. So just a few comments from myself and looking at gender sensitivity and gender inclusiveness and diversity within the research culture that is growing within Syria. It is something that we are starting to see, and it's not just simply from a health outcomes or how we are accessing or how Syrians are accessing health services, but looking at gender sensitivity at a health systems level and more widely. So this is a growing area of research, and it is being recognised by a number of researchers as well as funders as well. We know that a lack of focus on gender reflects biases within health research and inequities within the health system more widely. So this is part of the reason why it is so important. So when we are considering gender sensitivity, we're thinking about the role that gender plays in the work that we're doing, the research that we're designing, and how we're conducting this. And often a lot of research within both health systems and in conflict areas is again looking at health outcomes and access to health services, which is of course vital. However, we're not sort of looking at a bigger picture as well. So sort of going beyond gender disaggregated data, for example. So there is some research that that has been discussed today, which has been looking at the perceptions of female healthcare workers and their motivations for staying in Syria, for example. And also I just wanted to mention a particularly excellent presentation from Muna Kaiti on the policies and practices which are oriented towards female healthcare workers in Northwest Syria. So this is all really important in developing the research agenda further. As I mentioned, going beyond access and looking more at health systems, which actually gives voice to a much wider range of people, in fact, possibly half the population that is women, and of course their intersecting identities as well. So as we start to develop and evolve the research agenda in health systems in Syria, we also need to be thinking about gender and how that also brings into question power dynamics and worsening inequalities, for example. And these are particularly important and particularly problematic within the health system as well. We do know that within the Syrian conflict that women's participation has been crucial within the health system. And some people have even mentioned that war or conflict gives women more power, perhaps in this area, but this is still problematic given the political situation as well. So this sort of just wraps up what I wanted to talk about today, and that the research agenda really is evolving, which is fantastic to see, but we need to make sure that women are included and all of their intersecting identities, and also how women are leading these systems as well, and how that might play not only into the health system, but also thinking about other systems and also peace building.
Thank you very much, Kristen. And if you allow me to share that 2 weeks ago when we were, me and Kristen, in Turkey, and Kristen hosted a roundtable to discuss issues related to health, women leadership in the health sector. So the day before, we were in a workshop full of leaders in the health sector. None of them were women. So all of them were male, which really identified the gap. And then the other day we were discussing with some women leaders about challenges they are facing in getting, their position or their place in leading the health sector, and especially northwest of Syria. But I think this issue is applicable in other geographies in Syria. So it's really important that research highlight these issues and pave the way on how to fix this. So we now hear from Dr. Maher Aref, the head of mission of UOSSM France, about the same question about research culture and his experience and the institutions he worked in. Please, Dr. Maher.
Okay, I managed to do it. Thank you, Dr. Abdulkarim. Thank you very much. It's always very hard to reach the point to take the floor after this great colleagues from like Dr. Hani and Dr. Housam and Kristen. I go back to your first question about the research culture evolving, and I do really think, just echoing my two colleagues before me, it did significantly evolve through the previous years of the Syrian conflict. To be honest, it was not an easy process, but definitely it was a must process, which we both as researchers and mainly humanitarian actors reached to it, but as I might say, a little bit late. We are able to observe a significant increase in diagrams of both quantity and quality of research, and that today's third years of this conference is the biggest proof of this. Moreover, we are able to observe an elevation in the partnership between the research centers and the other entities, mainly the humanitarian entities. Regarding the encouragement and the disencouragement points, it is a huge topic to be discussed in a few minutes, but let me start by figuring some factors that encouraged the research from my point of view. First, I believe that the most important factor that the willingness of different stakeholders from either the research centers or mainly humanitarian workers, as example, to improve the current work. Quality was always a push factor for everyone to start including research in their priorities. I cannot say that we reached the optimum point, but the mentality has been changed positively, I think. Secondly, I would like to mention that the improvement of the data science in our local entities, this improvement was always accompanied with the fundamental questioning how we can use this data, like Housam said, how much it's helpful and in which purpose we can use it. The answers on these questions always led to the key actors from all sectors for a conclusion about the necessity of the research to evolve in the current status. Although we can identify vast encouraging factors for evolving the research culture, yet I think there are several factors that discourage this process. Let's be frankly said, maybe one of the most important factors that's also mentioned by Dr. Hani, which is the fund. Like always, most of you know that the current status analysis of the Syrian conflicts, the leading sector is a humanitarian sector, especially in the northwest, northeast of Syria. The conflict is classified as L3 as well, and the majority of funds being humanitarian and dedicated mainly to life-saving operations, where we need to work a lot on the mentality of donors and research institutes to invest more on funds for research activities. And maybe lastly, I can say about the lack of the capacity that exists in the governance bodies, like we always discussed with our colleagues from the Research for Health SSS projects, which can get benefits of the results of the research, the absence of the clear national plans and sub-plans that can lead to discouragements of some researchers to invest in their resources. where I can say it's a no benefit or a less benefit conditions. Thank you very much.
Thank you, Dr. Maher. And the point of research impact was discussed even in this morning about, that sometimes we ask funders to put even more resources towards research, but in the same time, we need to measure the impact in such context. That if I'm, reallocating some funds from the humanitarian response to research, then I need to make sure that this research is making an impact, that either improving the humanitarian response or even contributing to alleviating suffering in such context. So lastly, we will hear from Dr. Diana Reyes, who managed to participate with us. Dr. Diana, please, the floor is yours, about research culture from your point of view.
Oh, thank you so much, Karim. And please, I'm not a doctor yet. I'm working on it. But thank you so much for having me on this panel. I'm so privileged to be a part of this panel with other esteemed colleagues and seeing new faces as well. I apologize, I can't turn on the camera. I'm still in transit, busy PhD student who, I don't have much to add to what was said before, all excellent ideas and contributions about and thoughts about how research culture has evolved. But I can speak from my personal experience that my career and my life really has been shaped by how research about the Syrian conflict has evolved. And it is what led me to pursue my studies, my doctoral studies, and specializing in research that's related to the Syrian conflict and its impacts. So just to reiterate some points that were mentioned by colleagues and my personal experiences with them, the research culture has shifted from more emergency to definitely looking at more chronic conditions, but also chronic circumstances for Syrians, not only inside Syria, but beyond. It's what's led me to focus my research on the mental health and integration of Syrian refugees outside of Syria and surrounding countries in Europe and in the US, because I think what we all have learned is that research can be very powerful in terms of informing programming, but also policy. And when you can inform policy and even inform the way money is spent on programming and the way forward in the humanitarian context, this can be even more powerful than publishing a manuscript. So I think I'm proud to say that all of us on this panel and in this conference have in some way, by conducting research, have committed to improving the lives of Syrians everywhere. And I think that's really important and something that we should continue to emphasize in the research that we do, is having policy recommendations that are practical, that are evidence-based, and that's something that I've been committed to throughout my career. The other component, I think, is that we've really evolved from conducting rapid reviews and rapid research to respond to the dynamic situation, to conducting more long-term research that's ethical and employs ethical practices. That's not to say earlier research wasn't ethical, but I certainly think now, with the opportunity to conduct more long-term projects, even rebuilding and repatching health trends and concerns that we didn't have data about beforehand. I think pre-2015 was when data really proliferated regarding the Syrian context. And before it's kind of a black hole. So now there's funding and opportunities to sort of rebuild our understanding of what happened in the early years of the conflict, and to do so ethically and making sure we're representing history well. And I think that's probably the most impactful thing our research can do, is really document history. That's what I tell at least the participants who are, health workers working under attack, when they ask me, what's the point of this research project that you're doing if nothing has changed on the ground? I at least tell them that it's our imperative to document what's happened and make sure it doesn't happen elsewhere. And lastly, I will say, I think the Syrian context has provided unprecedented lessons, maybe even tragically so, but really lessons that can be utilized in other contexts, other humanitarian contexts and displacement contexts. And that's something that I'm seeing now in the refugee policy work that I do with regards to the situation in Afghanistan and of course other contexts like Venezuela. Syria has taught, I think, the whole world what it's what it means to endure the impossible and then to even survive it. So the resilience aspect there, of course. And with that, I think I'll hand over to you, Karim. Thank you so much again for having me on the conference and for your attention. Thank you all.
Thank you, Diana, and thank you. And I would like to back on the point that you raised about the role of research in building the narrative, and you frame it in a way that some research will contribute to writing history. And I think this is really important in a way, in a conflict that, with a lot of complexity and very much geopolitical factors involved in shaping the narrative in this context. So it's very important to have objective research that have very clear methodologies in the way they document and describe the situation. And so thank you very much again, our panelists. And if any of the panelists would like to comment on some of what have been said or discussed, please, we have 5 more minutes for additional points or additional discussions from panelists. So please feel free, panelists, to intervene. Dr. Han, please. Okay. I'm thinking through Dr. Hani that I will direct this to you because I know you have more to say, please.
Well, thank you very much. I guess I want to pick up on a point raised by Hala in the chat, which is about how we do this, how we involve communities in research ideas, and maybe in a way also comment on a point also raised, an excellent point raised by Zahid around what is considered local versus Syrian. So there's a difference, right? And I think the answer is simple, simple to frame, but maybe difficult to implement, which is listening. I guess that, maybe this comes by profession, but doctors tend to think that they know what's best for you, right? So they have the expertise, the training to advise and say, this is what's right for you. And often miss the opportunity to hear and listen to what the other part is actually trying to say. And what I'm saying here is that it's not enough to actually provide a space for the community to identify issues and say, this is what we want you to look into. But it's also important to work with the communities, work with people to let them understand how to do this. I think the Syrian community has been traumatized by so much over the past 10 years, and even before that, to a point where it becomes difficult for people to express what they really believe in or the kind of issues that they want people to help with. I think this is really important. And again, going to Zahid's idea that, not every Syrian is a local. Yes, I agree. So sometimes you can be disconnected from the community, and this is not good. This is not good in terms that you might be looking into the wrong type of problems, or you might be interpreting information in a very, very wrong way. So I completely agree with these. And maybe a last point, maybe commenting on what Kristen mentioned before. I think we're seeing good information coming in terms of looking at gender issues or gender differences. But I think it's also important, or maybe a good opportunity that we see, is that we have more and more female researchers, female Syrian researchers coming into the picture. And we need those researchers to take their place in vocalizing what they're working on. So I'll just give you an example. We've hosted a webinar a few months back on COVID vaccine, and we were actually criticized by not being able to have at least one female speaker in that webinar. And I genuinely believe that this is true. And it could be that we didn't do much in looking for good speakers, but it also could be that researchers, I guess, female researchers are growing, and then they're gaining a lot of expertise in the research community. but they also need to get back to the roots and use the kind of knowledge that they have and the research that they have in actually talking to the community. And this is where I think that we're already having a good start, but I think this is something that we need to work on more. Thank you.
Thank you very much, Dr. Hani. Maybe we will end with this note if there are no other comments from our panelists. And the good thing about maybe this conference that we are setting, a practice every year, that there is a platform that to be used for researchers and public health researchers interested in the Syrian context to present their research every year, to encourage collaboration. Here, there is a point from Pretty Battle in the channel. Currently, one of the big challenges is research culture. Incentivization is only mostly an academic institution element, and broadening this out to NGOs, operational organization would be good. And that's what hopefully all of us we can move towards, and in the R4SSS project, and also in these sort of consortium that we when we established this conference, we try to move this incentivization research culture not only to academic institutions but also to other practitioners.